Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
It is a critical moment at a critical time. Cases of the coronavirus continue to spike. 1,012 new cases in the past 24 hours as the death toll sadly continues to rise. But make no mistake, there is hope and help on the way.
Just in now at 5, Ford has announced it will produce 50,000 ventilators in Michigan in the next 100 days.
Meantime, a sobering yet comforting sight as the Michigan National Guard began assisting at local food banks. This is video we shot today at Gleaners in Pontiac. In Detroit, Mayor Duggan says testing has massively ramped up. 700 people were tested today at the state fairgrounds, and he says he wants to roll out the possibility for all Detroiters with symptoms of the coronavirus to be tested and tested quickly.
I'm expecting by 3 o'clock tomorrow to be able to tell the people of the city exactly where you can go with or without insurance to get a doctor so that if you are in fact showing symptoms, you can get a prescription. Right now we're 10 days ahead of time on supplies, which in this pandemic is an eternity.
From the Detroit response, we now turn to the state response, and Governor Whitmer making big moves today. Jason Colthorpe kicks off our coverage. Jason?
Sandra, a lot to cover, a lot of action by the governor, including executive orders, spending bills she signed that will amount to $150 million, some vetoes that free up about $80 million, all to fight COVID. And while she did not extend Michigan's stay-at-home order from April 13th to match the national new stay-at-home order, which is now April 30th, she is still making it very clear Michiganders need to stay home and do their part. From the amount of those infected and dying to the equipment Michigan will need to fight COVID-19, the numbers were not good at the state's Monday update.
Unfortunately, we know that several of our hospitals in the state, particularly in Southeast Michigan, are at capacity.
Over the weekend, we received a shipment of 112,000 N95 masks from the Strategic National Stockpile, with another 8,000 on the way. Again, this is good news, but we still need more.
Governor Gretchen Whitmer signed several executive orders, including a hiring and spending freeze for the state and also expanding absentee voting. In fact, she'd like everyone to just stay home and vote by mail May 5th. She also went back through the budget with legislative leaders to make some line item vetoes to save money.
It's too early to determine the exact impact on state revenues, and knowing there is the potential for a significant loss in revenue, now is not the time to sign a bill for supplemental funding for anything other than dollars that can be utilized to help our COVID-19 response.
From the medical side, it was again a warning not to take the stay-at-home order lightly.
People, young people in their 20s, in their 30s, in their 40s are getting sick. People are unexpectedly dying.
Yeah, it's a big message they want to make sure gets through. It's not a time to let the kids play with the neighbor kids or have extended family visits right now. Now, Dr. McGeorge is going to talk about medical supplies in a moment, but as for medical staff, there is a shortage, and the state has set up a website, michigan.gov/fightcovid19. It's looking for any trained medical professionals to help out in this crisis. And the one position they need the most of, you might guess, nurses. Sandra, Devin, back to you.
That takes us to the next ingredient here, because in this battle against the virus, the ammunition that matters most right now is medical staff, along with critical supplies they need.
Right, and tonight we are getting a much better picture of what Michigan has and also the efforts to try to get more. Dr. Frank McGeorge is here now with an update for us. Doc?
Yeah, well, you know, an emergency order issued by the Michigan Department of Health and Human Services actually requires that hospitals provide daily updates to the state on their bed capacity, their levels of PPE, testing capacity, number of ventilators, and other key numbers. Tonight, we are able to share one of those reports and a snapshot of what we have where. As of yesterday, the state had 27,762 licensed hospital beds, 25,375 beds that were in place before the state of emergency, plus 2,387 that have been added so far. Now, as of March 26th, hospitals reported they had 1,622 ventilators. We don't know how many of those are currently in use, but the state's chief medical executive made it clear that number is not enough to meet the anticipated need.
We know we're on the upslope right now of cases. We know our hospitals are going to need more beds. We're going to need thousands more ventilators, and a lot of people are going to get sick.
The levels of other supplies are broken down by region. For example, as of yesterday, there were more than 300,000 N95 masks, nearly half of those in Region 2 South, which encompasses Wayne, Washtenaw, and Monroe counties. Region 2 North had just 26,000 N95s. That region includes Oakland, Macomb, and St. Clair counties. The goal of these daily reports is to help the state make sure scarce resources are being shared between regions as needed, even as they desperately try to get more.
To date, the state has already expended more than $80 million to begin securing the more than 20 million masks, 2,000 ventilators, 9 million ounces of hand sanitizer, more than 255,000 boxes of gloves, 2.4 million gowns, more than 2,000 beds.
Now, those are items that the state has ordered. As we've seen, that is no guarantee that they'll be delivered. It's also important to note, although all of the hospitals are required to supply their inventory numbers to the state, yesterday's report had only 74% of hospitals reporting. Back to you.
Yeah, and Doc, how much do these numbers really mean? Because obviously, as we've been watching them, they're changing constantly.
Yeah, that's so true. Given the situation that we're in, the numbers are already out of date by the time they're reported to the state, but they at least give us a little snapshot in time and the ability to see where we still have some capacity and supplies, and of course, where we don't.
All right. Thank you, Doc.
Meanwhile, top U.S. health officials out with a grim assessment today, saying the government expects deaths in the United States to reach 6 figures, and they say that's if everything goes well. Alice Barr in Washington tonight as President Trump has extended the federal stay-at-home guidelines until the end of this month. Alice?
Devin, the stunning new death toll predictions come with a sharp warning. Too many Americans are still putting themselves and others in harm's way by refusing to stay home.
The devastating toll of the coronavirus crisis is beginning to sink in as top health officials predict a staggering number of Americans are likely to die.
If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities.
Compare that estimate to the worst case of more than 2 million deaths if we did nothing. Social distancing remains our best weapon, but experts say too many Americans are refusing to follow the guidance to stay apart, still gathering in groups where the disease can quickly spread. President Trump now extending those distancing guidelines through the end of April, backing off his earlier goal to reopen much of the country by Easter.
The worst thing we can do is declare victory. We've seen this. Declare victory and then not have victory, and then have to do it all over again.
In New York, the U.S. epicenter, crews setting up a field hospital in Central Park today as a massive Navy hospital ship docks to relieve pressure on the city's overwhelmed hospital system.
What you see us going through here, you will see happening all across this country.
Detroit, New Orleans, and Chicago have now all been declared coronavirus hotspots. And as the virus spreads, so does the urgent need for ventilators and protective equipment for medical workers on the front lines.
I am asking healthcare professionals across the country, please come help us in New York.
Meanwhile, in labs around the world, scientists searching for treatments and vaccines, from a long-used anti-malaria drug to experimental plasma infusions. An arms race is on against a deadly enemy.
There's already a human trial underway for one potential vaccine, with more coming. But even moving at record speeds, it could be up to 18 months before a vaccine is widely available. In Washington, Alice Barr, Local 4.
All right, Alice, we are expecting today's live update from the president, and the coronavirus task force from the White House will bring that to you live as soon as it gets underway.
We also officially have a new starting date for this year's Olympic Games in Tokyo. The Summer Games will now take place from July 23rd through August 8th, 2021, exactly 1 year after the original dates. Last week, officials postponed the 2020 Games because of the coronavirus outbreak. The Paralympic Games will be held later, starting August 24th. All the athletes who had previously qualified for the 2020 Tokyo Games will get to keep their spots through to those new dates. Now to major news out of Macomb County.
Prosecutor Eric Smith says he is resigning effective immediately. This, of course, comes as he stands charged with 10 criminal corruption charges. Let's get to Mara McDonald live in Mount Clemens. This was a pretty sudden step here, Mara.
You know, Devin, I think that this resignation comes on the heels of the realization on Eric Smith's part that there was going to be a very public, very ugly battle over removing him from office at the Macomb County Board of Commissioners, which his brother chairs. The charges against Smith are serious, 10 in all, from the Attorney General's office, accusing him of using his civil asset forfeiture monies as a private piggy bank. The investigation into those monies by the AG took nearly a year of wading through the financials. You'll remember, Smith did everything he could to prevent county oversight of his funds. When that failed, it became clear there were serious questions about how he had been using the money.
I believe Eric's decision today to step down as the prosecutor here in Macomb County was the right decision. He's going to continue to face these current allegations and charges that are against him. But with that being said, there needs to be somebody who's going to be focused on the day-to-day operations of the prosecutor's office moving forward.
Smith, for his part, in his resignation letter says, there have been several allegations leveled against me by the Michigan Department of Attorney General in the past few days. I intend to wholeheartedly defend myself against those allegations. I have been part of the criminal justice system close to 30 years. Know that I have absolute confidence that our cherished justice system will bring forth the truth and exonerate me. Back here live. So the question is, now what? Smith resigns from office. Well, it's up to the Macomb County Circuit to name a replacement. I'm going to have more on that coming up live at 6. See you then. We're live in Mount Clemens. Back to you.
You bet. All right, Mara, we're off and running on this Monday. Let's check in with Ben.
Devin, chilly start to the week, but these are the coldest numbers that we're going to have to get through for the entire next 7 days. We'll look at the warmer weather and when the sun comes back next.
This place was supposed to be packed with people. This was supposed to be opening day, home opener for the Tigers. But this is our reality. So we talked to a fan, a business owner, and one of the Tigers about how they're coping.
I'm Hank Winchester. Help me, Hank. Here's the good news. The governor expanding unemployment benefits, making them available to more Michiganders. The bad news, how in the world do you file with a website that is constantly crashing and a hotline that's busy? We'll have that story tonight.